A 67-year-old patient, fatigue and intermittent lower back pain, unintentional weight loss, normocytic anemia, elevated total serum protein, mild renal impairment, multiple light lesions in the vertebrae. Which of the following is the most common complication associated with this patient's underlying condition? So we see back pain, anemia, elevated total serum protein, renal impairment, and also weight loss. A clear multiple myeloma case. In the previous video we talked about it and the crab mnemonic. And by the way, it's not a must that all of the crab features appear in the vignette like we see here. Nothing mentioned about calcium. And that does not exclude multiple myeloma. Also, we see here high total serum protein. As we already mentioned in the previous video that this disease causes high protein gap more than 4. Also, I want to remind you that this disease causes monoclonal proliferation of plasma cells, not polyclonal. So always remember that. Polyclonal causes might include infections or autoimmune diseases. So now what's the most common complication? Actually, all of these might be complications except for D, because multiple myeloma does not cause hyperviscosity syndrome. It's more characteristic of another disease that is very much similar to multiple myeloma called Waldenstrom macroglobulinemia, a disease that we will talk about soon. It looks very similar to multiple myeloma. So as we already said, all other choices are potential complications of multiple myeloma. But here the question wants the most common one. And the most common one is E, recurrent UTI. And this is an information you should know, that recurrent infections are the most common complication of multiple myeloma, especially UTIs and pneumonia. This is very high yield and you should know it. And the reason for that is multiple myeloma causes impaired humoral immunity and it causes overproduction of dysfunctional plasma cells and decreased amount of normal immunoglobulins, and that causes recurrent infections. So always keep that in mind. And here are our side notes which I recommend you to read.